So here to provide you today some insight into resources and tools that you may not be aware of is Jenna Wiens, who is one of our 3 co-directors of Precision Health, along with Bermaji Nalamuthu and Sebastian Zoller. In addition to her work in Precision Health, Dr. Wiens is an associate professor of computer science and engineering in the College of Engineering at the University of Michigan and heads the MLD3 research group. She is going to take us through a brief overview of exciting developments and also bring us news about the Office of Vice President of Research Bold Challenges initiatives. Thank you, Jenna.
Great. Well, thank you so much for that introduction. So I am going to, before we close, give you a quick update on what Precision Health has been up to in recent years. And I promise I'll be quick. I'll echo other speakers in that I'm thrilled to be here in person. I know many of you just want to talk to each other. So what is Precision Health? Well, we officially launched in January of 2018 as a campus-wide initiative. And Precision Health here at the University of Michigan is a data-driven, population-based strategy that develops and uses advanced tools and technology to discover and incorporate novel health information in individuals with the goal of improving health. So what do we aim to do here at Michigan and Precision Health? We want to improve health outcomes and eliminate health disparities. Joining me in this mission is a fabulous team of staff and faculty, including my co-directors, Bermaji Nalamuthu from Michigan Medicine and Sebastian Zollner from the School of Public Health. Here are a few numbers that we took from the annual report that's on all of your tables. I'm pleased to report that today we have well over 200 members across campus, and we partner with over 13 schools and colleges on campus, and we've been able to make a considerable impact with respect to publications in precision health and external funding. So how do we do what we do? How are we structured? We have 4 work streams: cohort development, data analytics and IT, health implementation, education, and training. And these 4 work streams interact with research and use cases. So cohort development is really about collecting and curating new patient cohorts, new data sets that can be used for research. Data analytics and IT is about unlocking the potential of data we already have and building out infrastructure that then researchers can use to compute on the data and derive clinically meaningful insights. Health implementation is about taking those insights and putting them into action such that health outcomes improve and we achieve our mission. And finally, last but not least, education and training is all about seminar series and symposiums like this, in addition to our graduate certificate program. And we have 2 use cases centered around mental health and opioid misuse. And like I mentioned, we have a fabulous team of staff and faculty that are leading these work groups in these use cases. So many of you are here today in this room. We have Brahmar Mukherjee from the School of Public Health, Jen Smith from the School of Public Health, Megan Haymart from Michigan Medicine, Xiang Xu from the School of Public Health, Zhangming Liu from the College of Engineering, Karandeep Singh, who's in the room here, from Michigan Medicine, Paul Grant from Michigan Medicine, Vicki Ellengrad, our MC from the College of Pharmacy, Chad Brummett from Michigan Medicine, Amy Bonnert from Michigan Medicine, and Srijan Sen from Michigan Medicine leading the use cases. So let me give you a little bit of an update of what each of these work streams have been doing in recent years. So starting with cohort development, what data have we collected? One of the biggest data sets that we've collected to date are focused on the Michigan Genomics Initiative. So here I'm just showing you a subset of 2 studies from MGI ACE and MEND. But in total, we have close to 92,000 participants who have been actively consented to participate in this research study here at Michigan, with over 60,000 with genotyped data. We also have a number of tools. So we have PheWeb, which provides results from genome-wide association studies for over 1,500 EHR-derived phenotypes and over 51 million imputed variants. We also have Encore, which is an online tool for researchers to run their own GWAS studies. And we have additional advanced data types like star alleles made available to researchers in genomics. And one of the things that we had to do in March 2020 was think about how we could continue recruiting, but in a different way. So a lot of the data that are recruited through, or a lot of the participants that are recruited through MGI are recruited around the perioperative setting with in-person recruitment. And the pandemic forced us to shift this strategy and explore remote recruitment options. So we launched MyPart, where we're actually mailing spit kits to individuals and participants and recruiting people remotely over the phone. And this has helped with respect to increasing diversity around age. So on the left here, I'm showing you the age distribution of MGI participants, and on the right, the age distribution of MyPart participants. So you can see that with the remote recruiting strategy, we're recruiting younger individuals. And this is really important if we want to study the longitudinal health trajectories of people before they get sick. In addition, we've been able to make some headway with respect to increasing the diversity of the cohort with respect to race. So MGI participants were 86% white compared to MyPart, 75% white, increasing the diversity or the representation among other races. And we continue to try to further expand recruitment, both in terms of numbers and diversity of participants. Just last year, we launched recruitment through the My U of M health portal. So many of you have probably interacted with this health portal. We're really excited about this. We're the first to do this here at Michigan. We're also partnering with Christine Ajourou from Eastern Michigan University and the Institute for Social Research here at Michigan to recruit non-Michigan medicine patients, specifically focusing on in-person recruiting at the Arab Community Center for Economic and Social Services, or the Access Clinic in Dearborn, Michigan. And then we also have studies that go beyond just the electronic health record and genomic data to collect data from wearables. So we have PROMPT, MHB2, the intern study that you heard one of the other speakers talk about briefly, and MyPact, where we have information from heart rate monitors, from Fitbit devices, from mobile health technologies. And I'll tell you a little bit more about one of our use cases, PROMPT, which stands for Providing Mental Health Precision Treatment. And like I said earlier, this is led by Srijan Sen and Amy Bonner. And the goal of this study is to reduce the burden of depression through, one, increasing the capacity of healthcare systems through mobile technology delivered interventions, and two, accelerating recovery by better matching patients to treatments. We're doing this again through collecting data from wearables, things like Fitbits and the Apple Watch. The engagement has been incredibly high. So with close to 1,500 participants, we've had 92% complete a 6-week survey. And these data have now been linked to electronic health record data and are available through our Precision Health Analytics platform. So if you'd like to start learning more about these data or working with these data, please reach out. So that was about cohort development. Now I want to tell you a little bit about what data analytics and IT has been up to. And this is really focused on what data do we already have here at Michigan. We have data pertaining to over 4 million unique Michigan medicine patients. These are clinical data that are structured in the electronic health record pertaining to everything from laboratory results to diagnoses to treatments, prescriptions, outcomes. These data have been de-identified or coded and are made available to researchers across campus. You do not need a Michigan medicine login to be able to access these data. In addition, we've linked these data to other parts of the EHR and other data sets that we have access to, including imaging data, genomic data, and socioeconomic status data. Just to give you an example of the imaging data that we now have a repository with over 700,000 plus chest x-rays from Michigan medicine patients. And this is just from the last few years. We're working to expand this out to go back further in time. And these data are, again, made available through the Precision Health Analytics platform, so you don't need your own servers. We have those provided for you, HIPAA-compliant servers in which you can link the chest x-rays to electronic health record data. So you can ask research questions like which COVID-19 patients are at greatest risk of experiencing complications from the disease based on imaging results and other clinical factors. And just to put this in reference, these numbers, there are two other publicly available data sets around chest x-rays, Stanford's CheckSpurt data set and Harvard's MIMIC data set that are roughly 225,000 chest x-rays and 377,000 chest x-rays compared to the 700,000 plus chest x-rays we have here at Michigan. So like I said earlier, all of these data are available without a Michigan medicine login. You can sit in engineering and you can access these data. You can sit in LS&A and you can access these data through appropriate processes with the training and IRB approval. We also have self-serve tools, so you can query these data yourself and iterate. And this is fantastic from a research development perspective. And we have a world-class HIPAA-aligned compute environment that you can use that has both CPUs and GPUs and is now free for use. All right, health implementation. So this was brought up a couple of times in the talks this morning as being probably the biggest challenge to precision health and to accomplishing our mission. And that's in bringing all of the insights to the bedside such that we can improve patient care. And the implementation team in Precision Health has done fantastic work in terms of just operationalizing the process. How do you go from, hey, I have an algorithm that predicts clinical deterioration to having that algorithm running in real time in the health system at Michigan Medicine and integrated into clinical workflows so that clinicians know what to do with it. So not only do we have this process now that involves the Clinical Intelligence Committee and other governing bodies at the University of Michigan, we've done it. We successfully integrated novel clinical decision support algorithms within clinical workflows here. We also have an EPIC genetic module that will allow for genomic data management at the point of care launching this fall. So before I end, one more research success that I wanted to highlight. This is work done by researchers here at Michigan Medicine in which they've leveraged electronic health record data from Precision Health, so the 4 million plus patient records that we've made available, and found that pulse oximeters were less accurate in Black patients compared to white patients, leading to potentially higher rates of missed hypoxemia. And this important finding had prompted U.S. senators to ask the FDA to review its pulse oximetry regulation. So this is the type of impact that we can have in terms of deriving meaningful insights from the data and then translating that into care. So we're really excited to have partnered with the Office of the Vice President for Research on bold challenges. So these are 6 challenges that the office has come up with, and one of them is focused on smart healthcare systems for equitable access. And there will be a workshop, a pollination workshop, on May 9th for researchers. So if you're interested, I encourage you to check out their website, boldchallenges.umich.edu. Essentially, the workshop will provide an opportunity to talk with other researchers in this area, form teams, and then receive seed funding so that you can go out and compete for larger external grants. So finally, how else can you get involved? Well, you can become a member. So take advantage of all of the data resources and infrastructure, computer infrastructure that I've talked about today. You can sign up for our graduate certificate program, which is open to graduate students enrolled at the University of Michigan, and it's the first of its kind among institutions in the US. You can schedule a precision health presentation or demonstration for your faculty and students to find out more about how to get access to the data, how do you get into the system in terms of starting to develop your own AI on these data. And finally, connect with us. So if you know of projects in your school that could benefit from these resources, please reach out to us at precisionhealth@umich.edu. And with that, I would like to close by thanking all of you for coming today, our speakers, and especially our organizers, Vicki Ellengrad, Tina Krazier, where's Tina? Tina's in the back there, and Clarissa Piatek. Thank you so much.
Thank you. Thank you so much, Jenna. I also want to make sure that I thank our speakers once again. I thought today was absolutely amazing, and it was wonderful to see everyone here in person as well. There will be a recording of today's event, and it will be available to you in about a week or so, and we'll be sending out links to everyone who registered for today's symposium. Before we go, though, I want to thank Tina again and also point out that the centerpieces on all of our tables for the people that are in this room are sunflowers, and that was very purposeful, as sunflowers are the national flower of Ukraine, and what's happening in that country right now is weighing heavily on all of us. So if you would like, please take the centerpiece, share it with someone that you love, and think about the people of Ukraine. Again, thank you all for attending. Thank you so much for our speakers. And with that, we are now ending our first in-person symposium of 2022.